Headaches. They're one of the most common ailments we all experience at some point in our lives. Whether it's a dull throb or a sharp pain, most of us tend to brush off headaches as just a normal part of life. But how do you know when a headache is just a headache and when it's a sign of something more serious? Today, we're going to explore the science behind headaches, look at the warning signs that could indicate a more serious condition, and discuss when it's time to seek medical attention. By the end of this talk, you'll have the knowledge to better understand your headaches and feel more empowered to make informed decisions about your health. 1. Understanding the basics. Common types of headaches. Let's start by understanding the types of headaches that most people experience. Not all headaches are created equal, and recognizing the type you have can help determine whether it's serious or not. Tension headaches are the most common type. They often feel like a tight band squeezing around your head, and they're usually triggered by stress, poor posture, or muscle tension in the neck and shoulders. While they're uncomfortable, they're generally not dangerous. Migraines are a different story. They're more intense and often accompanied by other symptoms like nausea, vomiting, and sensitivity to light or sound. Migraines can be debilitating, but they're usually not life-threatening. However, if you have new, sudden, or changing migraine patterns, it's worth paying attention. Cluster headaches are another severe type, often described as intense, burning pain around one eye or one side of the head. They're called cluster headaches because they occur in cyclical patterns or clusters. While incredibly painful, they are not usually a sign of something life-threatening. These are the typical, primary headaches that are usually not dangerous. But how can you tell if your headache is signaling something more serious? 2. When headaches are red flags. The warning signs. Here are some key red flags that your headache might be more than just a passing discomfort. Medical professionals often refer to these as alarm symptoms or red flags because they signal that you need urgent medical evaluation. 1. Sudden, severe headache. The thunderclap headache. One of the most serious warning signs is a sudden, severe headache, often described as the worst headache of your life. This is known as a thunderclap headache, and it reaches peak intensity within 60 seconds. This type of headache can be a sign of a subarachnoid hemorrhage, which is bleeding in the brain, often caused by a ruptured aneurysm. Research published in the Journal of the American Medical Association, JAMA, highlights that thunderclap headaches require immediate medical attention, as they can be life-threatening. If you ever experience this type of headache, go to the emergency room immediately. 2. Headache with neurological symptoms. Weakness, vision changes, or confusion. If your headache is accompanied by symptoms like sudden weakness, numbness on one side of your body, difficulty speaking, blurred vision, or confusion, it could be a sign of a stroke. According to the American Stroke Association, a headache with these symptoms requires immediate medical evaluation. Strokes can cause permanent brain damage if not treated quickly. 3. Headache triggered by physical activity or coughing. Headaches that are triggered or worsened by physical activity, coughing, sneezing, or bending over could indicate increased pressure in the brain, which might be due to a brain tumor or other intracranial abnormalities. Studies in neurology journals stress that headaches exacerbated by such activities should not be ignored and warrant a consultation with a healthcare provider. 4. Headaches after a head injury. If you've recently hit your head and are experiencing headaches, it could be a sign of a concussion or traumatic brain injury, TBI. Symptoms like headache, confusion, dizziness, and memory problems should be evaluated immediately. According to research from the Brain Injury Association of America, post-traumatic headaches can sometimes indicate more severe underlying injuries, such as brain bleeds. 5. Persistent headache that won't go away. A headache that persists for days or weeks without relief, especially if it's new and doesn't respond to usual treatments, could be a sign of something more serious. Chronic headaches that don't improve with over-the-counter medication may indicate underlying conditions like meningitis, encephalitis, or temporal arteritis, which require prompt medical intervention. 3. What causes serious headaches? Understanding the underlying conditions. Now that we've identified the warning signs, let's look at some of the conditions that can cause these serious headaches. 1. Brain aneurysm. A brain aneurysm occurs when a blood vessel in the brain weakens and bulges, creating a risk of rupture. The American Heart Association states that an unruptured aneurysm often doesn't cause symptoms, but if it ruptures, it leads to a sudden and severe headache, known as the thunderclap headache. Early detection through imaging tests like CT scans or MRIs can be life-saving. 2. Strokes can be ischemic, caused by a clot blocking blood flow, or hemorrhagic, caused by bleeding in the brain. Both types can present with severe headaches, but the key is the presence of neurological symptoms. According to the American Stroke Association, recognizing the signs quickly and getting emergency care can significantly improve outcomes. 3. Brain tumors can cause headaches due to increased pressure inside the skull. These headaches are often worse in the morning or when lying down. As tumors grow, they may press on areas of the brain that control vision, motor skills, or cognition, leading to other symptoms like vision changes or seizures. 4. Meningitis is an infection of the protective membranes covering the brain and spinal cord. It causes inflammation, leading to severe headaches, fever, neck stiffness, and sensitivity to light. Meningitis can be bacterial, viral, or fungal, and requires immediate medical attention, especially in severe cases. Research published in the New England Journal of Medicine emphasizes that early diagnosis and treatment are critical to prevent severe complications. 4. When to see a doctor. Taking action on serious headaches. If you experience any of the red flags mentioned, it's crucial not to ignore them. While most headaches are benign, those that come with warning signs should be evaluated by a healthcare professional. Keep a headache diary. One practical step is to keep a headache diary. Track when your headaches occur, their intensity, triggers, and any associated symptoms. This information can be invaluable when discussing your headaches with a doctor and can help identify patterns that may indicate a more serious issue. Consult a neurologist if your headaches are persistent, severe, or accompanied by red flags. Consulting a neurologist is a wise step. Neurologists specialize in diagnosing and treating conditions of the brain and nervous system, including complex headache disorders. Get the right tests. Don't hesitate to advocate for yourself. If your doctor recommends imaging like an MRI or CT scan, these tests can provide critical information about what's going on inside your brain. Remember, it's always better to err on the side of caution when it comes to your health. Closing thoughts. Your health matters. Headaches are a part of life, but knowing when they're signaling something serious can make all the difference. Pay attention to your body, recognize the red flags, and don't hesitate to seek medical advice when needed. The key is to be informed, proactive, and aware. Your health is too important to ignore. Thank you for tuning in today. If you found this information valuable, please subscribe for more insights into understanding your health. Share this with your loved ones, and let's continue to learn how to take control of our well-being together. See you next time, and take care.